To final BDS PDC. Phenytoin induced gingival growth is one of the 5-marker questions from the subject of periodontia. Phenytoin induced gingival enlargement is a notable consequence of taking phenytoin, an anticonvulsant medication primarily used for epilepsy treatment. This condition can lead to functional and aesthetic issues, including problems with speech, mastication, and tooth eruption. The gingival overgrowth starts as a painless bead-like enlargement of the interdental papilla, gradually extending to the facial and lingual gingival margins. As it progresses, the enlargement can become massive, covering substantial portions of the teeth, crowns, and interfering with occlusion. Initially, the lesion appears firm, pale pink, and resilient with a lobulated surface. However, secondary inflammation due to plaque accumulation can cause the gingiva to become red or bluish red with an increased tendency to bleed. The condition is generally more severe in the anterior regions of the maxilla and mandible and does not affect dentulous areas. The enlargement often complicates oral hygiene efforts, leading to a combination of drug-induced and inflammation-induced gingival growth. Histopathology. Histologically, phenytoin-induced gingival enlargement is characterized by hyperplasia of connective tissue and epithelium, with elongated retipex extending deep into the connective tissue. The connective tissue shows dense collagen bundles, numerous fibroblasts, and new blood vessels. There is also an abundance of amorphous ground substance. Over time, the fibroblast to collagen ratio normalizes, although initial stages show high fibroblastic activity. Mechanism and contributing factors. The pathogenesis of phenytoin-induced gingival enlargement is multifactorial. Phenytoin stimulates the proliferation of fibroblast-like cells and epithelial cells. A genetic predisposition may determine the likelihood of developing gingival enlargement. While the enlargement can occur in the absence of plaque, inflammation from plaque can exacerbate the condition. Phenytoin-induced enlargement may occur in about 50% of patients on the drug, with varying incidences reported. Younger patients are more commonly affected, and the condition is not strictly dose dependent once a threshold is reached. Next point is the management. Management includes maintaining meticulous oral hygiene to reduce secondary inflammation, discontinuation of phenytoin, or switching to alternative medications may result in spontaneous regression of the enlargement over a few months. Surgical intervention may be necessary in severe cases, but recurrence is possible if phenytoin is continued. In summary, phenytoin-induced gingival enlargement involves complex interactions between the drug's direct effects, genetic factors, and plaque-induced inflammation. Understanding these mechanisms help in managing and potentially preventing this condition in affected patients. That's it. Thank you for watching. Do hit the like button, share with your friends, and subscribe to my YouTube channel. Stay tuned.